Hi, everyone. Thanks for joining us. My name is Adam Frater. I'm currently a patient here at STEMS Health in Miami Beach. I'm here with Dr. Choxi. We are exploring options of regenerative medicine for an old meniscus injury that I've been suffering from for a long time. I'm an athlete by profession, so it's very important to me, not just for my sport and my career, but also for my life to have a healthy body. So here exploring what can be done.
Well, thank you, Adam. My name is Dr. Choxi. I'm board certified in anesthesiology and interventional pain management. And I've been practicing both interventional pain management with regenerative therapies and regenerative medicine now for 5+ years. I've, at this point done 15 to 20,000 injections of the spine and joints, many of those with either PRP or stem cells, and have just been seeing fantastic outcomes for our patients. And extremely excited to be able to offer these therapies through STEMS Health to the Miami community.
And I'm excited to receive them and to see what we can do to start healing my body.
Absolutely. Well, Adam, thanks for coming in, and always happy to talk with you and answer any questions we can about regenerative medicine, PRP, stem cells, and what therapies we have to offer to help get your knee better, feeling better, not only for the short term, but for the long term as well. And certain natural therapies we have that can really help augment your ability to exercise, continue your athletic lifestyle, and prevent future injuries as well.
That's what I want. And, dying to avoid surgery, and just want to explore what the new age technology that's out there that can do something.
Yeah, absolutely. I mean, our number one goal is to, surgery is often needed in patients, but our goal is to try to prevent that as possible. Anytime we make incisions in the skin, it changes your anatomy, it changes your long-term outlook on pain, on lifestyle, and it's our goal is really to heal you as naturally as possible.
Amazing. So what's your background with this form of medicine?
Sure, this is a great question. So kind of background on me in general in medicine. I went to medical school at Vanderbilt University in Nashville, Tennessee, and I came down here to Miami to do a residency in anesthesiology. So I'm pretty heavy background in anesthesiology and pain management. Mm-hmm. And I did a fellowship in interventional pain management at NYU Langone in New York City. And I've been practicing pain management, doing injections for spine and joints now for more than 10 years. Along that line, I really fell in love with regenerative medicine. I kind of got a little bit frustrated with traditional medicine, steroids, leading to pain relief, kind of putting a Band-Aid on things. And myself looked and dived into regenerative medicine for alternative therapies for patients to really help them improve their lifestyle, their form, their function. And so for the past 3 years now, I've really dived deep into regenerative medicine, alternative therapies such as PRP and stem cells to get people back on their feet.
Amazing. So if it's okay with you, I got some questions I wanted to ask you. I wanted to write them down to make sure that I get everything answered that's going to make me feel comfortable, obviously, pursuing this process. So as I mentioned, I have a torn meniscus. Doctors have told me for years I'm going to need surgery. I saw one of the top knee doctors here in South Florida. He basically said they can trim the meniscus or they can sew it up. They won't know until they get in. So you get put to sleep, and you basically, when you wake up, find out if you have 6 weeks recovery or 6 months. And if they trim it, it leads to possible earlier arthritis because you have less of the material in your body. And if they sew it, you just hope for the best. But my understanding is a meniscus gets very little blood flow, so it's hard to heal. So I guess the question is, how can STEM help this specific injury?
Exactly. So you kind of nailed the head there. There's a lot of uncertainty with the surgical plan itself.
Yeah.
And a lot of times it's tough to form a surgical plan without actually coming open and seeing what's going on. There's always potential for, when surgery happens, to remove more meniscus, even more invasive surgery. The benefit of stem cells for your particular case is that, one, it's not invasive. It's a simple outpatient procedure where we do it through injections and needles. So there's no scalpels, there's no cutting, and there's very little recovery time for you. On top of that, the stem cells are very potent in regeneration of damaged tissue. Your meniscus does not have much blood flow to it, like the orthopedic surgeon told you. That's correct. The benefit of stem cells is a lot of the growth factors and nutrients that come with it promote blood flow, promote healing, and can be very powerful in repairing that damaged meniscus you have. So there's always surgery could be an option, if stem cells don't work for you, but there's high confidence these stem cells have significant regenerative properties to get your knee feeling better.
It's funny, as I've explored stem cell or even heard about it more and more, I feel like I need to take a step back, because what is stem cell?
Good question. So, everyone's probably heard stem cells. We probably remember movies like Jurassic Park, where they discover the mosquito and amber. They take the stem cells from that to make dinosaurs. So in short, stem cells are kind of the building blocks of life. All cells come from original stem cell when we're conceived or from conception.
Uh-huh.
And so the stem cells have the ability to differentiate into different tissues or different types of tissues. So what we're able to do is to harness the stem cells already in your body, concentrate them, and then inject them into certain areas of your body, in this case, your knee, and really promote the growth of new knee cartilage, new knee tissue. It's very similar to what you already have.
So these are just like special cells in my body that more or less can copy other healthy cells.
Correct. And they also signal for other cells to come to the area to promote growth, to promote regeneration, and to help with your healing.
But I already have this in my body.
Yeah, so these are natural. These are your body's own cells. Because they're located in certain parts of your body, and it's very hard to access them because they're not just readily available in your bloodstream. But what we're able to do is to harvest specifically where these cells are, concentrate them, and then directly and precisely put them into injured areas.
And I think I've read somewhere online that like you have more stem cells, I think earlier in your life when you're like a baby, or even as a kid. Maybe this is why kids get injured less as you get older.
It's correct. Yeah. So if you think about it, when you were a kid, and you're playing outside riding your bike and you fell and you scraped your knee, or back on your feet in a couple of
couldn't get hurt.
Yeah, you're like a rubber band. You just bounce back right now. As we get older, our body, obviously ages, and our stem cells also have something called stem cell fatigue. So as we get older, our stem cells are not necessarily as potent or as powerful they are at healing. That being said, someone like you or other individuals in their 20s, their 30s, their 40s, even their 50s, the stem cells are still extremely potent and extremely powerful at healing. But that's another reason why we like to concentrate them to get as many stem cells into an area to give the most chance for success.
Amazing. Oh, well, I guess in contrast to just stem cells, because I know that your clinic also offers PRP, which I have a loose understanding of. Maybe can you explain what PRP is and why we might be doing stem versus that as an option, or why somebody might explore both?
Yeah, it's a great question. So PRP stands for platelet-rich plasma. It's very similar in terms of regenerative properties in that we take your own blood rather than stem cells. We take your blood, spin it down, and concentrate the plasma, which is really rich in platelets. Mm-hmm. These platelets have a lot of growth factors and nutrients as well, and are also very good at promoting healing, promoting regeneration. They're just not as strong or as potent as stem cells. A lot of people say stem cells are 10 times more potent than PRP. That being said, depending on the type of injury you have and the type of pathology, whether it's your shoulder, your knee, your hip, your spine, PRP is often a good choice to start.
I've had a lot of friends with some good results from PRP.
Yeah, PRP works very well. I think it's something that certainly can work for you, but the added benefit of the stem cells is something that would be much better for, say, a meniscal injury, which doesn't have much blood flow, where we really want to promote new growth of tissue.
And truthfully, I just want the best treatment because between the career and this being my my hobby.
You're a very active guy, man. You're on your feet, you train a lot, and you want the best opportunity for healing.
Yeah, absolutely. So you mentioned that, we extract the stem cells from, they're my stem cells. Where are they coming from?
That's a good question. So your own stem cells we commonly refer to as autologous stem cells, meaning coming from your own body. And so there's two areas of your body that are really rich in stem cells. One is bone marrow, which we can take it either from the back of your hip, your iliac crest, or from your femur, your tibia. So the bone marrow, really rich in stem cells, also has a lot of growth factors, nutrients, and also has something called hematopoietic stem cells, so blood stem cells, which really promote the growth of new blood tissue, vasculature to help continue healing of injury. And the other part of the body is your fat. Your fat actually has a lot of stem cells that are present. So we commonly do fat or adipose harvests, where we take fat, maybe not you, especially low body fat, but for a lot of patients, we take fat tissue and able to concentrate that.
Yeah.
There's some studies that show that fat stem cells are really potent as well. And goes back to sort of historical ancestral DNA that fat had to store a lot of tissue to survive long winters or periods of famine,
right?
And which led to a lot of storage of stem cells.
Interesting. So does that mean the average, if somebody is overweight because they're unhealthy, somehow that fat is holding more stem cells, which might make them...
There's potential that there is a higher concentration or number of stem cells in their body and in the fat tissue.
I guess this is... Yeah, I'm curious because obviously with added weight comes possible diseases or other health issues.
But it's important to remember that the stem cells that are in fat are not necessarily in circulation. So they don't necessarily have more healing or better
So you could extract it from the fat, like the bone marrow in my hip, but just because they're fat doesn't necessarily mean that
the stem cells are working for them. They're kind of storing them, but they're not necessarily in circulation in their body.
I understand. Okay.
Don't recommend putting on weight.
No, because I sure. But no, that's good to know because I definitely would have been curious, on those points. I'd love to know more about, the treatment process. So obviously you need to extract the stem cells from my hip, and then we need to get them in my knee. We're going to do a little bit in my back as well because I have an old herniated disc injury, which flares up from time to time. Is that the same day, the same week?
Yeah, so we do everything at the same time. One, it's your safety number one priority, and then also make it convenient for you so you're not coming back several times. So the patient experience for you, we want you to be as comfortable as possible and safe as possible. We do everything at an accredited surgical facility with Stems Health, especially for the bone marrow aspiration and the bone marrow harvesting. So the way it will work for you, come into the surgical facility the morning of the case. We have a whole team there ready to take care of you, get an IV in for you, a full anesthesia team that's going to go through their checklist and make sure, you meet all the safety standards to have anesthesia. For the case itself, you'll be lightly sedated, similar to going to a dentist to get your tooth taken out.
Also not out completely.
You're not going to remember anything. You're not going to feel anything, but there's certainly no breathing tubes or mechanical ventilation. It's just a conscious sedation.
That makes me feel way more comfortable, yeah.
So all the medicine through your IV, you're breathing on your own. If we need to wake you up and talk to you, you'll wake up pretty quickly, but you're not fully knocked out. Then we do the bone marrow harvest. Obviously, clean everything. A sterile technique.
Yep.
We're obviously wearing masks, gloves, sterile equipment for you. We do the bone marrow harvest first. So we go into the back of your hip, the iliac crest, take the bone marrow, and it's all done under X-ray guidance for you. So we take out the bone marrow, we take enough we need. We're able to put that in a centrifuge to spin it down and isolate the stem cells at the appropriate concentration. And then at the same time, we are able to inject both the joints of your spine as well as your knee, all under ultrasound or X-ray guidance. And then simply, once we're done, put little Band-Aids on. You take to the recovery area where we watch you just to make sure you recover from the sedation. And then you're pretty much free to go home. The entire process, probably about 2.5 hours total of your time. The actual time that we're doing the procedure itself, probably about 45 minutes. Mm-hmm. So it's a pretty quick and efficient experience for you.
How much stem, or I guess bone marrow, is extracted, and then how much it's known by increments, like how much stem cell you get?
Correct, yeah. So we take about 60 cc's of bone marrow, and from the 60 cc's, we're able to concentrate that into about 6 to 10 cc's total. The thing is, we don't want to do too much because then the concentration gets diluted. Sure. And the stem cells are just not as potent and as powerful for you.
All right, so I guess that opens a couple questions. One, after this is all done, I recover from the anesthesia. Am I walking out of here?
Yeah, absolutely. So you'd be walking, you get full strength. Your knee and back may be a little bit sore and inflamed, but it's like you had a tough workout and you feel kind of a little bit uncomfortable.
Oh, just inflamed like a workout.
Yeah, you're not going to have any major discomfort. Obviously, we'll give you pain medications if you need it for that night or the next day. But most of our patients are pretty much back to regular activity within 48 hours.
Okay. Oh, so this isn't like a surgery by any means.
No, much less invasive than surgery.
So how long after we've now injected the stem cell in my knee and my back I don't imagine I'm gonna wake up and just feel it do its magic. No, that would be nice. But how long does this start to have its effect?
So stem cells can really, to see the peak and max effect, take upwards of 4 to 6 weeks to start working for you. Mm-hmm. And some patients report, almost 3 months later starting to see effect. So it's one of those things, it's not an overnight fix. We have to give the stem cells time to work. Yeah. So it makes sense. The body needs time to heal and repair. We're kind of expediting or boosting that process, but it still needs time for everything to kind of take effect and heal.
Got it.
That being said, you would see likely some anti-inflammatory effects, some pain reduction pretty quickly, probably in a couple of weeks.
And I imagine I want to do PT like while I'm over the course of those 6 weeks, right?
Yeah, so it's every should kind of the same thing, The injection part is step 1, but there's 10 steps for you to go to make sure you do the best for you. And physical therapy is a huge component of that. We encourage all our patients at STEMS to really, get into good physical therapy. We have great physical therapists that we work with that are really experts in regenerative medicine, but sort of that mobility, strengthening, range of motion exercises. That's what your physical therapist is going to be great at to make sure you have the true success you're looking for.
Do I need to be careful that like I'll ruin it if I go do something too aggressive, like diving right back into a sport?
Yeah, so we should moderately increase your activity. We don't necessarily want you going on the day of injection to the next day back into your full workout regimen.
Sure.
And I think that's where the physical therapist will be really good to make sure they're kind of grading your progress and making sure you have that full strength. That being said, I tell the same for all patients. We recommend at least 1 week of no strenuous activity on the treated joints or area.
Okay.
So you can certainly work out. You can do swimming, lighter activities. You can do more upper body exercises, but no impact on the knee or low back for a week, just to make sure you don't re-injure yourself.
Got it. So I'm going to feel fine. I'm going to walk out here. I'm going to be able to do all the extreme physical activities, but it just makes sense to get the most out of this, to kind of chill for a week. And then slowly wrap.
But that doesn't mean you can't do physical therapy.
Yes.
You don't want you to do physical therapy.
Right. Okay. I guess side comment, as for my hip, you're taking the stem cells out of, that's going to be full of marrow again in the future?
Yes, your body regenerates itself, right? And so the bone marrow will regenerate, will replenish your body, pretty quickly. And those 60 cc's are honestly a very small amount compared to the total volume of bone marrow you have in your entire body.
What's 60 cc's like?
Yeah, probably about the size of that cup.
The whole cup, really? Is in my hip?
Yeah. More than that. You're way more than that.
Oh, okay. This is probably a really common injury that you see. You treated this injury specifically with stuff?
Of course, we see meniscal injuries all the time. The knee, ACLs, LCLs, PCLs.
Yeah.
We treat arthritis all the time for the knee, as well as all joints. The shoulder, we see a lot of labrum and rotator cuff tears.
Yeah.
For the hip, almost on a daily basis, we're seeing labral tears, bursitis. And then for the spine, also herniated discs, facet injuries, whiplash injuries. So we see these orthopedic injuries almost every day.
And then as for this injury, which you've treated with stem specific to, let's say a guy in his 30s, I'm 33, meniscus injury, slight tear, not terrible, can walk and do things, but it's having pain. I guess somebody similar to me, the most similar that you've treated. What was the outcome?
Yeah, great outcomes. I mean, I never want to make promises to patients that you're going to be back like Adam Frater, running, being active. But, I would, similar patient with meniscal injuries, I've seen them return to normal function, back doing Ironmans, back in CrossFit competitions. Because we're not only treating the meniscus, we're going to treat multiple knee structures at the same time.
Yeah.
So even, things that aren't bothering you that may have micro tears are going to straighten, they're going to heal. We're going to increase blood flow to your knee. We're going to increase, potential for cartilage growth. It's really strengthening your knee for the long term as well.
That's actually huge because along with this injury, my doctors and the PT that I've been seeing have said, one, the inflammation from this injury causes even the nerve in the area to kind of go off. It causes the muscles. I think I'm dealing with cartilage degeneration. So yeah, this is going to help more than just the meniscus. Great.
Yeah, so the inflammatory process is vicious when you do have an injury, because the only way to really stop that inflammation is to take a lot of anti-inflammatory medications, a lot of rest, which people don't have time to rest. You need to walk, you need to move.
Right.
And so, this really helps to stop that inflammatory cycle and promote healing. And the inflammation is really what's the culprit of your continued pain and that progression of the arthritis. So we're able to break that cycle, start the healing cycle, which the stem cells are excellent at doing. It should help to slow down progression of a lot of the cartilage damage and arthritis that you already have.
I just want to think all the other places that I could add stem cell.
We can get a needle anywhere we need to.
We'll help next time. So what makes stems here at Miami Beach different from other clinics?
Yeah, I think, there's a lot of people who do regenerative medicine. There's a lot of people who offer stem cells and PRP. I mean, our biggest thing is we're using the highest, most qualified physicians. I myself have done probably now 50 to 20,000 injections, whether that's for the spine or joint. So there's a lot of just repetition and being very good at kind of knowing how to place needles appropriately for patients. Two, we only work with the best physical therapists, with the best imaging centers and the best sonographers and the best surgical centers to ensure, one, quality of care for our patients, safety, and also efficiency for our patients. We pride ourselves stems from A to Z care. So the day you walk in, we'll coordinate all your care from imaging studies, follow-ups, actual procedures, and the most importantly, the post-procedural care as well. And, the biggest thing is, I think, looking for physicians who do this every day, day in, day out.
Yeah.
I myself am board certified in interventional pain management, meaning I did a fellowship specifically for injections. I think there's a lot of physicians who kind of add it on as a service to their existing practices. So you just need to be really careful about who you're choosing to manage your care.
Yeah, I see that often, like people that just add on various medical services because, you know, you can upsell in businesses, but they're not like the super pro just at that.
The stem cells, our focus is only regenerative medicine. We take a lot of pride in making sure we work with the best vendors for medical supplies to make sure we have the best equipment for our patients as well. And we're not trying to move in 10 different directions. Our focus is regenerative therapies.
Yeah, I love that. I guess I was going to say, what credentials should people look for when choosing a doctor for these treatments? I think you kind of touched on it a little bit.
Yeah, maybe answer specifically. So, you know, whenever you're looking for a doctor, one, obviously you want to make sure they're board certified in that specialty that you need done. Two, you know, there's a lot of physicians who are family medicine, emergency medicine doctors who are certified, who have experience, but they don't have, you know, the vast experience of someone who's done pain management fellowships. The other thing is asking really where their products are coming from. There are people, unfortunately, who say they're giving you stem cells. They're getting them from labs or, you know, in a vial. You really don't know what product they're giving you.
That's because stem can come outside of just my body. We should also harvest them.
You can always harvest them. There's commonly taken from the umbilical cord tissue of newborns, which in the U.S. is not FDA approved, is not allowed. And so you need to be really careful when you talk to other specialists or the physicians and ask questions about where they're getting their stem cells from. Are they vetted labs? Are they safe to be used?
Yeah, I mean, I personally just want my own stuff. I don't want some random person's genetic material in my body. So if the stem can come from me, I feel like that's...
Yeah, it's often the safest and best approach. If, you know, young, healthy patients, you know, being able to take stem cells from your own body, obviously the most natural and sort of holistic way to heal yourself.
Definitely makes me feel the most comfortable too.
Absolutely.
Additionally, I guess a lot of people, because stem is pretty expensive, a lot of people will travel internationally to get stem cell. I've been pitched this being in Colombia and other countries. It didn't even necessarily seem like this was a certified and/or doctor. Like they have stem and they'll just squirt it in your body wherever they want. So I guess what's the benefit or the benefit to doing it here and the risks and/or if there's any benefits to doing it internationally?
Yeah, I mean, I'll start with the benefits of why doing it here. One, you know, you're getting a U.S. trained, U.S. certified physician taking care of you. And you have access to that physician, at least with stems, you know, before your procedure, during your procedure, and after your procedure. You know, while we like to think everything in medicine is 100% safe, you know, side effects and things can occur, but we hope they don't occur. Right. But we want to make sure you're the best hand to get if that does occur. So that's why, you know, due to the U.S., it's beneficial. Right. Two, convenience. You know, do you really want to travel to another country? You pay for hotels, pay for flights, pay for, you know, combinations of food.
And then put you to sleep.
And then put you to sleep. Correct. You don't really know. You don't meet that doctor until the day of your procedure, which is scary. And then
it all seems so scary. I can't even,
And then, you know, there are international stem cell clinics that are doing a good job. They're doing it properly. And I don't want to speak ill about all centers because I think there's some very good centers internationally that do a great job for patients. But as stem cell tourism increases, there's going to be a lot of people popping up who will get claimed to do it. And you just really don't know where their cells are coming from, what's being injected in you, and kind of what the follow-up will be. Especially with something like that, you know, you want to make sure things are tested for viruses, bacteria, funguses. You want to know where the cells are coming from, what the donors are. And not every stem cell center is going to provide you with that information internationally.
Yeah, what I've noticed is in today's world, everybody has a professional website, looks extremely credible as far as you typing them in on Google,
right?
Seeing their online presence.
Yeah, it's easy to talk, but right. You know, can they really back it up with the data when you ask for it?
I already know the answer to this one, but I think it's good for the viewers. Is stem cell covered by insurance, and if not, why?
Yeah, unfortunately, stem cells and PRP, both regenerative therapies, are not covered by insurance at this time. You know, there's a lot of us, you know, physicians and patients advocating for it to be covered, but for whatever reasons insurance companies have, they're not, you know, approving these therapies right now.
Yeah.
You know, that being said, at STEMS, we do work with you and we'll be able to bill at least components of your therapies as out-of-network coverage, or at least submit the claims to insurance companies. Then also we do accept, you know, FSA and HSA, which are flexible spending accounts and health savings accounts, will be credited towards treatments as well.
It's amazing. And I guess for anybody watching and considering STEMS as an option here in Miami Beach, the offices are beautiful. The staff's extremely friendly. Every conversation I've had with the doctors, they've been very willing to answer any and all questions. And I ask a ton of questions. I've done a lot of questions even just before this interview. And yeah, I just appreciate, the transparency with everything. I'd love to also introduce the other doctor and get his take on things, get him in front of the camera as well. Maybe we grab him.
Yeah, absolutely. My partner, Dr. Jared May, will answer a lot more questions as well. And he has, a robust practice. And together we're excited to be able to offer STEM's help to the Miami community.
Amazing. So we'll swap you guys out. Appreciate that.
Always a pleasure.
Yeah, thanks.